day. It's another great day to suck your fat out and get your confidence back. I'm here answering any questions that you might have, any concerns that you might have about liposuction. I'm going to show you some awesome pictures and try to explain to you about what is actually possible with liposuction and how we can eliminate the tummy tuck, the need for the tummy tuck. So none of the pictures you'll see behind me, none of these individuals are getting the tummy tuck, and you can see that they all have loose hanging skin. They all have stretch marks. They're all mothers of multiple children, and many of them are older than 40. So despite all those things that are stacked against you, we are still able to get these amazing results, which is super cool. What's up, Brandon? Miriam, what's up? See, I was about to set up my consultation, and then I find out I'm pregnant. Well, congratulations, Miriam. I'm glad we didn't find that out at our office. We do pregnancy tests at our office before the procedures, and we have yet to find somebody that way, but man, exciting times. When the people said that they were about to schedule a consultation, they found out they were pregnant.
Oh no!
No, that's a good thing.
That's a good thing?
I don't know.
I mean, that is a good thing. Don't get me wrong, that's a great thing. Absolutely. Congratulations. Yeah. See if we can get this, let's see, Facebook looks okay, Instagram.
Stacy, what's up? Thank you. Stacy said happy birthday.
What's up, Granville?
Hey, what's up?
Did you know this guy had a birthday yesterday?
No one told me until I read it on Facebook. Everybody else.
Yeah, happy birthday yesterday to this guy.
Yeah.
Look at these curls.
I turned 25.
So luscious. 25 again.
25.
For the third time, maybe.
Man, and it's my biological age.
Right.
You know, I did the Wii Fit playing with my kids, and they said I was 32 years old. So
Dude, I wouldn't put you a day over 19.
yeah.
Right.
I'm gonna live forever. So
Right.
What's up? Let's see, can you please tour the country performing procedures? That would be freaking awesome. So I had this idea, and I have tons of ideas, but I had this idea once to create you can take, I was thinking like a bus or some type of like a semi truck. I've seen this before. Some of the
Like
drug
MRI machines?
Well, the drug companies do this. They take a semi truck and then they convert it into like a cadaver lab, so they can do cadaver labs and sell their products and stuff, whatever. So I was thinking we could do a liposuction where we tour around the country and do lipo out of this huge, it'd be big facility.
So that'd be super fun. The problem is, like, logistically, it's just not feasible. You'd have to get medical licenses in every one of the different states and blah, 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 blah.
Too
Our
many
medical
regulations.
system is, not, I don't know. There's just way too much red tape. We take a national accreditation exam to become, medical providers like we are, and then yet we have to apply to each individual state to say, hey, yeah, can we please have privileges? And, it's funny because the regulations are different in each state and the requirements are different, and it's just...
So the states have to get their money.
Yeah,
It's interesting. I was actually searching for this because I was interested in doing this type of thing, going around the country and touring and doing liposuction, and I found that for doctors they can get a national license, which is good in all the states. However, it does not exist for VAs as of yet.
Yeah. And it's really funny too, because like DEA license, don't get me started on that. The bottom line is like there's like different regions for, the DEA offices, even though it's a federal number, it's a federal entity, all right? And they want you to have different DEA numbers for the different states that you work in, which is,
It's a money
ridiculous, absolutely ridiculous.
I call it the mafia.
Right, yeah, so.
Kathy Ramos says, is there an age limit? There is no age limit. Age, it's as I was saying earlier, like your biological age is way more important than your chronological age. So you could be an individual who is 70 years old, but chronologically, but your biological age could be significantly younger since you take care of yourself. Ultimately, this procedure is for healthy individuals. So if you're healthy, it doesn't necessarily matter what age you are.
So let's clarify what healthy means, because we ran into this today. Yeah, there was a younger individual who was in her mid 40s. She was like ready to get her life back in order, okay, and maybe get down to her fighting weight whenever she was a welterweight champion. So she shows up, right, and she waited to the very last minute to get her lab work done. So the lab work will not lie, right? The lab work tells us how your body is and what state it's in. And usually, if you're a poorly controlled diabetic, we can find out pretty easy, okay? So it's important in medicine, nobody gives us medical providers a slap on the back for writing that prescription, okay? The onus is on you to go ahead and take that medication and do some lifestyle modifications to improve your body system, all right? I don't know what she was thinking, but anyway, she ended up coming all the way out here to Vegas. Her diabetic profile was completely way off. She's been poorly controlled diabetic for like 4 years, just thinking that she was going to go ahead and control it with diet and exercise. It's just, listen, you have to get in contact with your medical provider and control some of these disease states, and i.e. be a healthy person, a healthy candidate for this procedure, because diabetes is one of those disease states that it can prevent your healing, and it can cause a lot of other problems. So we are absolutely concerned about your health. Okay, we take that. That's the foremost thought that's on our minds when we do these procedures. We want to improve your health by doing the liposuction. Okay, we don't want to have problems later on. Okay.
Miriam says, can I set up ahead of time for when I have my baby? Maybe I should start paying in advance. It's ultimately the plan that you set up for yourself is your plan. And we give you the opportunity to pay in advance if you want to do that. It's kind of like a layaway type plan when you pay monthly payments, and when you're paid in full, we move forward. However, trying to plan ahead of a pregnancy there's a lot of variables there. The typical recommendations is to wait 6 months to a year following a pregnancy. However, if you're breastfeeding, the recommendations would be to wait longer. And a lot of that has to do with the hormones circulating through your body. It does affect the fat. So
it does, and you can develop disease states or changes in your body with those hormones running through. So yeah, we like to have you at least 6 months. Probably closer to that year mark. It came up again. That was another topic that came up. How long after a C-section? I like a year, just because it takes a full year for the full scar remodeling and inflammatory process to kind of stop. And so that's when it's typically going to be strong enough to withhold some trauma. So a year.
So someone says that was a good idea. They're talking about the whole traveling the country, and said, when will you be back in South Florida area? So just to clarify,
next week
we cannot do procedures anywhere other than Nevada per our licensure. Actually, I do have licensing in California, but we're not set up to do anything out there, and there's no plans as of right now. So
I got an idea.
Fly out to Vegas.
Let me get a California license. We'll set up shop right on the beach. We'll rent a spot and we'll just do it right there on the beach, and you can have a very vistic, scenic area to undergo liposuction. Pretty amazing results right here. Awesome, huh? Goodness gracious. This was the Julia Roberts lookalike. For HIPAA reasons, we can't divulge her name unless she wants to, but look at how amazing these results are. Phenomenal. Handy Mama on YouTube says, finally scheduled my arm lipo. I'm so excited but nervous. Listen, congratulations. You are like one step closer to getting your body into where you want it to be, and improving all of the things that we talk about on our videos. The nice part about what we do is we set up this Facebook support group. Lots of girls in there. I actually just got banned last night. I don't know if you noticed that, but I posted a couple of BBLs, and maybe I didn't blur out the crack of the button. So I only got it like 3 or more hours, and then I'm finally off and I can go ahead and comment and stuff. But anyway, jump on our social media group. You can connect with other females that have had the arms done and the bra rolls, and they can walk you through it, and that helps with the anxiety, okay? So jump on there.
Ledimi says, hi, I calculated a quote and my total cost would be around $12,000. Do you adjust the quote once you have a consultation? I'd love to do the procedure instead of getting a tummy tuck. They want me to, but the price wise is hard for me to do. Ledimi, so if your price is $12,000, it's likely you're in the higher category, so the category 4, so you're a larger individual, which means your BMI is between was it 39 and 44. This is very large procedures when we do that. That's the reason why they're charged the way they're charged, because it's a lot of work. We got to get a ton of fat off you, but the results are phenomenal.
Yeah.
And you know what? It's not the same as a tummy tuck at all. In the tummy tuck, they're just cutting away the skin and they leave most of the fat behind. So the people that get the tummy tuck, you're gonna need liposuction again anyways. So get this done right. And you know, I know it's expensive, but it's a lot of work for for us to get you the results that you need. You know, and it's, if you were smaller, it'd be cheaper.
Yeah,
you know?
and our pricing reflects that, right? So if you're in category 1, I know it's unfair, I get it. But you know, if you're in category 1, you come in and get an abdominal 360, you know, it's probably closer to $6,000, right?
So if she says it says category 3, then I mean, so I know category 3, it's not 12,000 for the liposuction. So
she's probably thinking about doing the front of the abdomen and then coming back and doing the front of the abdomen, coming back and doing the love handles, hips, and lower back, which is $12,000. Yeah. So you know, listen, if you want to go ahead and dedicate some time and effort and trying to get down in that category 2, where we can probably do it all in one session. The problem is when you're in the category 3, typically your body does not allow us to go all the way around the midsection. It's just too much work. Your body will not tolerate that. And so for your safety, we've divided it up into 2 different procedures, and these 2 different procedures, you know, gives you amazing aesthetic and cosmetic results. And we work on the front of the abdomen, and then we do the love handles, hips, and lower back. So we're scheduling a lot of those patients now that did the front of the abdomen last year. They're coming back, and you know, they're getting ready to, you know, finish it off with that Coca-Cola bottle appearance.
But you'll see a lot of these, especially these larger individuals, these are just the treatment of the front of the abdomen. So, you know, a lot of people carry a huge amount of fat right on that front part of the abdomen, which causes a lot of back pain. It causes stress to the joints, and not only that, it gets in the way of everything that you do because it's right in front of you. So mobility's you know, not that good.
Very limiting.
Very limiting.
Nobody really you know, creates clothes for this particular demographic. They you know there's a couple of them that say, yeah, this is for the bigger body habitus, but you know, oftentimes when people get into this demographic, their shape is so unique and so different that none of the clothes really fit right anyway. So let's get you into some nice fitting clothes, and you know, let's get you a new wardrobe and get you feeling better about yourself.
Let's see, Rachel Gonzalez says, how much is the process? How much is the cost? Okay, so Rachel, it's really easy for our patients to get a quote. So we've developed this quick quote system. You can go to our website, and right on the front page of the website, you can click on the link there to go through the process for the quick quote. You can get it immediately. Like right now, while we're speaking, you can go get this right now and figure out the cost. Now, it's a generalized quote, so you know, there may be changes made during your consultation. So if you're serious, the idea was to get a basic idea of the pricing, and then if you're serious and you're interested in moving forward, then you get a formal consultation, which you speak directly to us, and we get to see your pictures, and we determine if it's the right plan, and we come up with everything. But for the most part, I would say about 75-80% of the people that go through the quick quote, it's accurate.
So there was a question on Facebook. It said, do the prices change every year? So listen, you know, Trevor's prices have been pretty much the same for a while. I came on last March. We discussed it at the end of the year. How can we help more people? And you know, our conclusion to that was, well, let's do some price adjusting. So it doesn't change every year, but we found that, you know, we really enjoy what we do. We feel like we can help more people by doing this type of system. You know, we still are, you know, trying to compensate for the larger individuals and the extra work that we're going to have to do while making it fair for them. So this was like an attempt to go ahead and try and include a lot more people and being able to intervene on their behalf. So, you know, it's probably not going to change next year. This is, you know, the system that we've got, and it seems to be working very well for us. You know, I mean, we're just absolutely inundated with consultations and, you know, scheduling and stuff. And so, you know,
so here's the
see where
truth.
it's at.
The prices can change anytime. We move them up, we move them down. We do you know, specials. We do all kinds of stuff. So the prices change all the time. So if you like the prices now, I would take advantage of it. Plain and simple. I mean, these are the best prices we've had in a long time. And this is it. This is our flat pricing, and you know this is our significantly lower than they have been previously. So if you like it, take advantage of it. Lademi says that was a total from our whole front, the back, each section, extra the legs and arms. So if you do full body liposuction, you can get the quote to be up to 20 or 30,000. That's easy, Lademi, but you can't do all of that in one procedure. So focus on what you're going to do with one single procedure. And I package the stuff together on purpose because that's one procedure. Like the whole entire 360 all the way around the waistline. We're not doing anything else with that. So we're not going to do your back. We're not going to do your legs or your arms. We're not going to do that when we do the midsection. We do the whole midsection. It's already a significantly huge procedure. So you know, I know that there must be other places that are doing this, like full body liposuction. It's totally not safe.
So it's funny. I wish I could pull up the photos real quick. I just did a consultation the other day. This particular lady went to Iran, right? Went to Iran, and she got her arms, her bra rolls, her midsection done, and her legs done all at one time. They put her under, and I said, "Oh, okay. So why are you here for me?" Right?
Redo everything.
And sure enough, she pulls up her stomach, and man, they like
butchered.
It was absolutely horrible, right? It was horrible. So listen, I'm not saying that there's not people that can do full body liposuction, but it is very intense. And to get a good job, man, it takes a long time to do that much liposuction.
Right.
You're on the table for a long time.
Like
I mean,
8 or 9 hours.
we work very efficiently and we work hard. You'll see us sweating the entire time. Bottom line is, we do these cases like an abdominal 360 anywhere from like, you know, an hour and a half to 3 hours, okay? And that's quick, because nobody else is doing it that fast, okay? That's how fast we get our 360s done. So if you're thinking, okay, 360 plus arms, bra rolls, and legs, like how long is that? You're on the bed for like 9 hours.
Right.
That's not safe.
It's not safe at all. And that's the reason why we don't do it, because your safety is our primary goal. And like this is a cosmetic procedure, so there's no reason to have major complications with this. None.
No.
And nobody wants that.
Yeah, we want you to wake up the next day. We want you to have, you know, we want you to heal, and then we want you to like show everybody over the next couple of months, like, you know, how you've changed your life, and we want you to experience that positive reinforcement, and everybody coming up to you saying, "Oh my gosh, you look so great! What did you do?" You know, I mean, that's what we do. That's what we love to do.
So Deluxe Harley says, I'm 71 and had a wonderful results doing back and front. Best decision I ever made. These guys are wonderful. Well, thank you so much.
Absolutely.
Stacy
We know who that is.
reminding people, if you haven't joined the private Facebook group yet, definitely go and do that. My Shape Lipo support group. You can go on Facebook, search groups. This is an area where all these pictures that you're seeing behind us come from the group. These are the actual individuals are posting these pictures. These are not our pictures. These are posted publicly, and which means that you can communicate directly with these individuals.
Right. Take a look at this one. I mean, so whatever got her to this state, okay? You know, you call it genetics, you call it lifestyle, you call it bad habits, whatever. 7 weeks later, she looks like this. 7 weeks. I mean, you know, I guarantee she didn't go into a single other clinician's office and they say, "Oh yeah, we can do that without doing a tummy tuck." No, like there is no tummy tuck here. This is absolutely just liposuction, and you know, for where she started and where she's at now, that's pretty amazing. And the results are only going to get better because she's only 7 weeks out.
So one of the differences and the reasons why we focus specifically on one area is because we maximize the amount of fat that we get out of it. Now, a lot of doctors, what they'll do is they'll tell you they're going to do full body liposuction. They charge you for full body liposuction, and then when they do it, they only take out a limited amount of fat because we're limited on how much fat we can remove. We're limited on how much of the numbing medication we can use. So what do? They try and spread it out over the whole area that they charged you for, which means they charge you for everything, but they get a limited amount out of all the places, which means you get mediocre results on everything, which then also means that then you have to get it redone, which is another expense. So I don't care whether you get it for cheaper, you get full body liposuction, you go to Colombia or Mexico and they do a crappy job on you, then you have to pay to get it redone. It sucks.
So Siggy Mama says, "Hey Kale, listen, you guys want to see some amazing results? She got a 360 done and she looks phenomenal. She's in the support group. You know, jump on there, connect with her, and have her show you her pics. I mean, she looks incredible, and she's probably got a couple more kids on the way because I know her husband won't be able to keep his hands off of her. Oh wait, husband or boyfriend? I think it's boyfriend. Sorry,
husband and boyfriend.
Yeah, absolutely.
Okay, Karen says, "Can you be awake during this procedure? I'm afraid of being put to sleep."
Yeah, so bottom line is we do not put people under. We do not sedate you, okay? We use local anesthesia. We inject medicine right into the layer of the fat, okay? It numbs it. We control the bleeding with the medication that we use in that concoction, and then we're able to sculpt your body while you're awake. And we want you to talk to us the entire time so that we can really understand how your body is responding to this procedure. We say it a lot. We can take out as much fat as your body will allow. So if your body allows us to go to work and you can go ahead and get in the right mindset and turn the anxiety down, dude, we will make magic happen, I guarantee. Today was an awesome example. We had this, I typically, I've got a couple of like demographics that I really don't like to work on, and it usually falls in that like younger 30 down to the 20s, okay? And I think what it comes down to is maybe they didn't fall off a bike, or maybe they didn't climb a tree and fall out of a tree. So they haven't really experienced something that's painful, okay? So this is uncomfortable. So this young particular female, she was in her mid-20s, she comes in, right? And her anxiety is through the roof. And I have a talk with her about it, and I try and calm her down. We get through, about halfway through the procedure, and she's not doing well. So I turn off the machine, and I sit down, and we have an eye-to-eye. And I said, listen, you've got to get on top of this anxiety. Otherwise, we're not going to be able to finish and give you the results that you want. So she took a break. She excused herself, used the restroom, came back. Dude, she was amazing. She was a completely different person. And right there, I realized, listen, I mean, I already knew, and we profess this, right? It's all about what goes on in between the ears, okay? And if you can control this is nothing.
Yep. See, Cat Rod says total hysterectomy due to uterine cancer, and you gained weight afterwards. Is that common?
Yeah, that happens, absolutely. So, for a variety of different reasons. It can be depression, okay? It can be, a hormone imbalance. I mean, there's a lot of reasons that happens.
So Ladimi says, do you do skin tightening at the same time? Is that an extra cost? So Dimi, we include the Smart Lipo laser skin tightening with the specific areas that are of higher need, meaning if the chin, the underarms, the front of the abdomen, the inner thighs area. Now, these are the most common areas that people need it. So we include it no matter what, and at no extra cost. Now, if you have a lot of loose skin, so let's say you lost a significant amount of weight and you have loose skin all over the place, we do offer the option for you to get the Smart Lipo on all of the areas that you're treating. So if you're doing 360 lipo and we only do Smart Lipo on the front of the abdomen, you may want to do it on the sides and the back as well if you have looser skin. So that's an additional fee.
So Siggy makes a comment, the pricing is so reasonable. Okay, listen, she comments that because, I appreciate that she commented because, she's blue collar, she's working class, like not all of us have trust funds. I sure wasn't born with one, I know you weren't. So, listen, it's affordable. If you want to have some results like this and change your life, it's very attainable.
There's a cost to everything. And not only is, with this, there's the financial cost, but it's also important that you change your lifestyle, and you have to put forth the effort to change, or else you're not going to maintain these results over the long term. So these individuals, I'll tell you, I've been doing this for 15 years, and the ones that succeed are the ones that make the lifestyle changes and they maintain their results. The people that don't do that, it takes about 2 or 3 years, and they'll gain enough weight to where they feel uncomfortable and insecure again, and then they're coming back and they're paying again for the same areas, which drives me crazy. And
listen, I'll tell you right now, revisions are difficult, and we're not looking for that demographic. I mean, sure, we could probably collect some more money on the back end after you've made some poor lifestyle choices, but bottom line is we're looking for those individuals that want to improve where they're at in life, want to stave off a lot of the disease states like diabetes, hypertension, and live longer and be around for their kids, right? Those are the ones that we're really looking to intervene on, and that's why we decided to kind of revamp the pricing so that we could help more people. I mean, that's the mission, right?
Nina Garcia says, how many weeks or months can I sit after BBL? So the BBL, the generalized recommendations are no pressure for 2 weeks and limited pressure for 2 months. Now that limited pressure for 2 months, it's a very vague term. What does limited mean? And we leave it on purpose because the truth is nobody knows. But the studies showed that people had an active loss of fat for about the critical period was 2 weeks, and then they continued to lose fat for up to 2 months. And they found that putting less pressure on the area allowed for more blood supply and the creation of new blood vessels to help feed the fat. So when you sit on it, you're essentially choking off the fat. But again, the truth is nobody really knows. So if you sit for a minute, 10 minutes, an hour, I don't know whether it's going to change your results. I don't know what the effect's going to be. But I do know that the people that get the best results, they tend to follow the rules. And the ones that don't get the results and are unhappy, when you question them, they've always broken the rules. Can this be done with a vertical hernia?
With a vertical hernia in the abdomen?
I'm sorry, ventral hernia.
Oh, ventral hernia in the abdomen? So, yes and no, okay? I mean, if it's a small hernia, maybe. There's risk with it. We would really have to see what it looks like. Okay, if it's a big gaping ventral hernia, no, probably not. You don't want a bunch of, wands and probes that could potentially poke that, okay? So, it would have to be like the optimal conditions, and they would have to be in a certain position. It would have to be, this and that. So, I mean, the
ventral hernias can be repaired though. If it needs to be repaired, it should just get it repaired. They put a mesh on there, then it's not an issue at all.
Right.
If it's protruding out and you have your bowels sticking out, then obviously that's a big concern. But the question was very vague, so we don't know. So I would get an evaluation with us.
And you know what? Here's the cool thing too, because I just had this with one of my patients. She had, or with one of our patients, she had a hernia, and she says, well, I want to get it, and do I qualify? And so I hooked her up with a local surgeon, right? And she paid cash, did it at a surgical suite, didn't have to go to the hospital. It was an outpatient surgery. She paid him I don't know, I want to say $4,000, I think is what she paid him to have that repaired. And then she came in and got liposuction. I mean, it was a pretty simple fix. It really was. And so moral of the story is, if you're really looking for something like this, there's ways to get it done, okay? You can call a surgeon up and, discuss terms with him, and, maybe he'll work with you.
This is an awesome picture here. Young lady, she was, what did you say she was, about a month out?
I think so.
She's still very swollen and bruised. You can see how that fold that covered up her underwear is significantly smaller. Now, it's still very swollen, which is why it's still present. I'm anticipating that this is going to go away completely within a couple months. So I'm super excited about that. But I mean, can you imagine the difference that this makes in this individual's life? I mean, unbelievable.
Her activity level goes up.
Wow.
Her energy level probably goes up. Her excitement for life goes up. I mean,
sex life. I mean,
yeah.
how does that belly get in the way? I mean, I don't know.
I'm with you.
I think that it's really, when people say that this is expensive, I'm like, what the hell is this worth to be able to get that belly out of the way?
Well, yeah, and we talked about this before, right? So how expensive is diabetes? How expensive is hypertension? How expensive are all of these disease states that you develop when you're in this obese state? Over time, you're spending a lot more than what you're going to spend on, the procedure.
Right.
So, you come in, you use this as a springboard, you get healthy. We do liposuction on you, and then you get committed to a healthier you, and then you're around for your grandkids.
Yeah.
Maybe you'll be able to walk down to a graduation of your grandkids that graduates from Stanford, right? With the highest distinction, and goes off and gets a Rhodes Scholar. Who knows, right? But you don't want to miss moments like that.
Yeah,
So
this is,
healthy.
You may look at this and you see the change. However, this is a health change for her. This is a huge health change. And there's no statistics on how much longer she's going to live because of it. But I'll bet you it's going to add on 10, 15 years to life.
So Stacy makes the comment. So if you guys are really interested in how profound these changes can be, jump on our Facebook. There's a journey section. Also, Stacy is very active in the support group. Ask to see her pictures. Type in her name, because she comments a lot about a lot of things and stays very positive, shows her pictures, very unapologetic about how amazing this can be. And she writes in here, life will change. Trust me. So
Patricia says, physical exam required. So we don't require, this is Stacy right here. We don't require a physical exam to move forward. However, we do require a formal consultation, in which case we get pictures from all angles, and then we speak to you on the phone for 15 to 30 minutes and make sure that we answer all of your questions and make sure that we answer all of our questions.
Right, and with that, we ask you all of your health questions, all about your medical health and your history, and we hope that you tell us the truth, right? Because we're in this together, right? We want to make sure that you have amazing results, because you're going to basically go out and show the world how amazing this procedure can change your life, and we're the guys that did it, or at least helped you out with it. So so there's we do a very thorough screening, make sure that you're medically qualified for this particular procedure.
How is the recovery after Lipo 360?
I mean, this depends. Like, typically what we've seen is people go back to work after 3 or 4 days, okay? Some people have gone back to work the very next day, and then some people, they drag it out a little bit longer. I mean, that depends on how your body system responds. I mean, but generally, as a general rule of thumb, we tell everybody, usually by day 3 or day 4, you're ready to kind of get back into life.
I went back to work the next day. I rode my motorcycle home after the procedure and rode it back to work the next morning, and I never skipped a beat. So that is possible. I don't recommend it to anyone, but it is possible.
So the caveat to that is he was doing liposuction at the time, okay? So it's a very physical, strenuous job, and he was working very long hours when he was doing it. So, if you're committed to what you're doing, there's a way to get things done.
So Miriam says, what if we go to Las Vegas? Can we have an in-person consultation, or is it only online through photos? We've been doing this stuff a long time, and I've seen pretty much everything. So there's very few issues that I feel that I need to see in person. However, there are situations that I do recommend it. So we are in the office, and people can come in. It's way easier to do these things remotely online. So we prefer it that way, and I would start that way. And if you need more, then we can do more.
So the reason that a lot of people like to do that is they just like to get a good feel for what it's going to be like, and they like to get a feel for the clinician. Well, part of the genius of doing these social media broadcasts, you get to interact with us via social media. You get to see our mannerisms, you get to see how we speak, how we act, how we think. And so basically it's an interviewing process. And if you like what we say, trust in the fact that we know what we're doing, and that we've done a lot of these, and we've really taken the time to make sure that we streamline everything and make sure everybody stays healthy. So if you trust in that, we're a good fit.
Michoacana, self-esteem goes up. I truly need this about to schedule my first appointment. Awesome.
So this one particular case that I'm showing here. So this lady is pushing, late 40s, 50s, right? She's got an office job, and genetically she was really blessed with a big caboose, right? And some bigger hips. And look at how profound this intervention was. This belly basically sticks out way past the breast. You can't really see it in these pictures, right? But over here, after we take it down and make it flat, look how nice and look how nice and round those boobs are. Look how it gives the illusion, well, I mean, it's not an illusion now, that the boobs are a lot bigger, right? When over here they look really, really small. If you saw the other photos, you would look, because this is so big. This
It's all comparison.
Yeah.
Right? It's proportions, and you can see her proportions have totally changed. Which changes everything about the person, and it can do that for you as well. So, this is the change that is common with our patients. We do large volume liposuction, make huge dramatic changes in your body, which it has to change your mind. You'll be seeing yourself differently in the mirror, and everything changes. Your confidence changes. Do you guys put the extra fat in the bottom? Yes, that's called fat transfer. It's just an extra fee of $2,000 for that process. Zara says, Stacy is my unpaid therapist.
Dude, yeah, she posts, she's like,
Stacy's amazing.
She's always throwing positivity out there. She's fun to be around. And when she comes into the office, she's been in 3 times. She's just super infectious. She just has that calm demeanor. She resonates on a very, approachable frequency. So
Zara says that she placed her deposit. Congratulations. We'll be seeing you soon. this is one of my favorites. I think this is probably one of my favorites of all time. I mean, this blows me away because in looking at her, if I looked at just the pictures, I would question whether this individual had visceral fat. So visceral fat is the fat behind the muscle, and it's
the bad
it's
fat.
the bad fat that
Yeah.
surrounds your organs, and it's not good for you. So if in just looking at the pictures, that's what I would have assumed for this young lady. And this is, I guess, one of the benefits of seeing people in person. You can identify and examine these type of issues. However, for this person, the bulge in the front of the belly was so thick that you can see how big of a change it was when we take it away. And all we're doing is taking away fat, which is incredible. So if you have a lot of fat to take away, we can make these unbelievable changes.
Yeah. So Stacy, I think it was Booby Brown asked the question, how much fat can you take out? Listen, again, we can take out as much fat as your body will allow, okay? So like numbers, we don't talk about numbers because it's not important. We consider how much fat your body can actually tolerate, and that's why you're awake during the procedure, so we can make sure that you're doing well. And then Siggy Mama says she shopped around 4 different places. I would assume it's probably here in Vegas. Listen, prices kind of vary by region, but I think we're all kind of like in the same ballpark. Siggy, if you don't mind, post some of your pictures. I don't know if you can do that here, but like they are phenomenal. And we did an abdominal 360 and we got a lot of fat out of her. We were super aggressive with her and she looks amazing. So yeah, she's not lying when she says, we can do some work.
Real Queen says, do you do thighs? Absolutely. Technically we can suck fat out of any part of your body. Thighs, arms, back, chin. Pretty much anywhere. In fact, I've heard Kim Kardashian got lipo on her toes. So theoretically these things are possible, and it's just whatever your problem. When you go through our quick quote, it's going to be the common procedures that we do. That's what we're quoting you on the quick quote, is the common stuff. If you have some other demands or needs or wants, get the formal consultation. We're both very creative and we can come up with plans to do just about anything. So
it's funny. So real quick, Real Queen 1 says, what happens to the loose skin? So funny story. I know another doc, right, and he does liposuction. He does not like to do big cases, right? He likes to do smaller cases, right? Because it's easier. You can get, a change. You don't have to worry about the loose skin. Like he doesn't do it as aggressive, and he doesn't do as much as we do. Okay. So he calls me up as I'm driving home, and he says, hey, listen, I've got a consult for you. This lady came in. She's, a little older, in her 60s. And, she's got this really big protruding belly. I told her that I didn't want to touch it, but this is something that you specialize in. And I said, yeah, okay, great. All right. So I talked to her on the phone, right? Now, keep in mind, she had a conversation with him, right? And so this is all his bias that he was telling her, okay? She could not wrap her head around the fact that she did not need a tummy tuck. Mm-hmm. And I kept showing her pictures. Like, while we're talking, I'm texting her pictures, befores and afters, of patients that we've done. And I'm confirming with her, there's no tummy tuck here. There is no tummy tuck here. If you do it the correct way, and the way that we've started doing it, and it's amazing. The results are amazing. And so, what happens to the loose skin? It pegs. The skin comes back, and oftentimes it looks up. It's pretty amazing for the amount of fat that we've taken out. Okay. Now, is it perfect? No, but your skin wasn't perfect in the first place, because your belly has gotten so stretched out that there's stretch marks and stuff. And so if you give it time, it will absolutely retract, and once it forms scar tissue to the abdominal wall, it looks amazing.
Yeah, so a lot of these pictures are really, we want you to see what is possible for you, because a lot of people, they've been told that you have to do a tummy tuck, and you may not want that. Maybe you do want it, but maybe you don't want it. Maybe you've seen these huge scars, these nasty scars, these dog ears, these terrible results for tummy tuck, and there's lots of those, lots and lots of them. So maybe you want to avoid that. And if you do, we're just showing you what's possible. That you don't have to get a tummy tuck. You certainly, you don't have to. And you can get the results without the tummy tuck. And, just don't allow other people to tell you that that's not possible, because you've seen it.
So these are all pictures, like every one of these pictures that comes up. No tummy tucks, right? No tummy tucks. So, I mean,
If you don't believe us, jump on the group and, you know, see for yourself. Connect with some of these patients.
Yeah.
There
That's
you
the
go.
thing, you know, you really don't have to trust us because it honestly, it doesn't even matter because we say this stuff all the time. And just like, you know, Kale was saying that even though we send pictures to people, it's like they don't believe it. So that's why we need your help. We need our previous patients' help to spread the word and inform people. You know, go to our private Facebook group. If you're new to this channel, you know, go to our private Facebook group and just connect with some of our previous patients because they're real people, and you'll see they're real people. You can communicate them. You know, like Stacy's so willing to talk to you and help and ask, answer questions. But it's not just her. There's a lot of them.
Yeah.
A lot of our previous patients that are there.
So yeah, listen, I completely understand like the bias as a consumer, right? You walk into a shop and you walk into a lawyer's office and the lawyer's going to say, oh yeah, you need my services and it's going to be this much. He's going to try and talk you into it or sell his services. The plumber, the same thing. The painter, the same thing. Listen, this is why we do these photos, right? Our results speak for themselves. If you want to have something like this, okay, we can give that to you. And basically we can't, these are not our photos. These are the photos that they send us, that our clients, our patients send us, and so they're real. So if you want some of this, we can give it to you. How much is a mommy makeover? Well, that's interesting. It just depends on what you classify as a mommy makeover. I mean, I don't know if you do like an abdominal 360 with a fat transfer to the boobs, or a mommy makeover could be like, you know, just the front of the abdomen with a fat transfer to the butt. I don't know. That's kind of like one of those weird terms that people throw around. I have no idea what it actually means.
So whatever you want, go to our quick quote and you can get the price right there. But a mommy makeover is just a term. It's whatever you want. So stop, you know, placing yourself in a box that you have to get all these certain things just because they call it a mommy makeover. We you know, make our packages to get the best possible results. So whatever your issues are, that's what we address.
So Sandy Valley, I had lipo in pubic areas in the past with no good results, and it is likely that if I attempted again, I'll get the same results. Or I'm sorry.
No, if you go to
is it likely?
if you go to a different person who does different techniques, you will get different results. We treat people like this all the time. They go to other doctors. I've had patients that have gotten 3 or 4 procedures in the past, and they come to me, and it's like a night and day change immediately. So, you know, look, there's a lot of people out there that don't know what they're doing. I'm certainly not as aggressive as we are. Don't get these kind of results. So if you go to people like that, it's a shame, and I'm sorry, but we can fix things. So if you still have an abundance of fat there, and that's what you're concerned about, then it's easy. We can just get the fat out.
So Jenny University says, when would you say to get lipo? When you're ready. When you're absolutely tired of like putting on your clothes and they don't fit anymore, or hiding in photos, or, you know, avoiding social situations, or, you know, not going on those dates because, you know, you're not sure how he's going to look at you and you don't want to feel like uncomfortable. That's when you come in and get lipo, okay? When you're ready to change your life and get healthy, okay? The follow-up to that is, how many times do you need to come to Las Vegas to do it? So most of our patients come from out of town, and how many treatments do they need? That just depends on your body, okay? So if you're one of those body habituses where we have to work on the front of the abdomen the first time, then we work on the front of the abdomen. We get as much fat as we can get out, and then you might come back and we do the love handles, hips, and lower back. Who knows?
So, but it's one procedure for one area that we're treating. So, like, you don't have to come back for the front of your abdomen multiple times. We get all the fat out in one procedure in that area. Then we move on to the next. Many of our patients come for full body liposuction, which could be 3 or 4 different procedures. So it kind of depends on what your plan is. But if you're just treating one section, it's one procedure, done. And you should never have to get liposuction in that area again because we get enough fat out.
Oh, so that absolutely answered her next question. Is it a one-time procedure or multiple?
Yeah. See, Yuli Vera says, I want to do my BBL, but I have to return to work in 7 days and my job is driving. It's tough.
It is. So, I mean, but that being said, there's a ways of doing it, right? There are, you know, there's some pillows and stuff, you know, can just impede some of your
your results, but you know, the liposuction absolutely would be helpful.
Yeah. The BBL is a challenge, right? It's
BBL is a
sitting.
challenge. Yep,
And there are tools that you can use like pillows and stuff, but you know, having to drive, I mean, if that's what you do for a living,
So-
that's 8 hours a day or
So
12
how
hours
many?
a day.
But how many truck drivers did we do last year?
A lot.
I think we did at least 3 that I can think of
For
right offhand.
BBLs?
I don't know if they had BBLs. One of them did for sure. Tricky Mickey, she drives truck for a living.
Yeah, she wasn't a BBL. Okay, and the elasticity. You know, you just got to look at these pictures and you'll have an idea because everyone's a little bit different, and so you know, many of these women are mothers who have had multiple kids, have damaged skin from stretch marks, and you know, many of them have gained weight, you know, large amounts of weight, and lost large amounts of weight, so they have loose skin. But despite that, is what the results that you see. Despite those things, is the skin still retracts back quite nicely, and the results are not perfect. Nothing's perfect, right? But it's amazing what's possible. It's amazing. You know, in Lizette, it's really just a matter of what your expectations are. Because if you want to have that fake look where the skin is pulled unnaturally tight, then a tummy tuck might be right for you. However, it comes with a huge scar. It comes with a new belly button, which looks weird. And they also don't do enough liposuction, so it typically doesn't come with the right shapes. So the choices there, you know, you have to look at this stuff and weigh the options, and you know, it might be the right option for you, it might not be. So that's what we're just here to show you, what the different options are and what's available.
So Siggy says she didn't just shop around in Las Vegas or the regional market, she shopped around out of state.
Yep.
So yeah, so maybe, so like that's just a testament that she didn't find what she was looking for, you know, and she looked and looked, you know, and then on her 5th time she came across us and we killed it for her. At least I mean, I think we did, and I know she's happy with it.
Lademi says, do you do transfer to the hips for the hip dip? So, Lademi, that's actually, I have a whole different philosophy on that, and it's not about filling in the hip dip. The hip dip causes, there's a couple different reasons why it causes, but it's mostly because of the weight that you carry up above, and when gravity pulls it down, if things fold in different ways, and the hip dip is the consequence. So when you raise your leg out to the side, it creates a dip in the hip. So the solution is not filling the dip hip, rather it's taking away the waistline. And you can see this here. So we take away the waistline and the curves change, and that hip dip that you're talking about disappears.
So yeah, her hip dip, you can't see it very well in this picture, but you know, her hip dip was created by this big tire looking thing of, you know, just fat collection. It's very abnormal, very peculiar type of thing.
It compacts and causes the fold or the dip that you're concerned about. So it's not about filling that in, it's about taking and creating that waistline. So if we create that waistline, the hip dip goes away.
Yeah, and you can tell right here, like look at the butt themselves, right? Like both cheeks, okay? So they look squished, they look cellulitic, okay? But when you alleviate the pressure above, look how nice and smooth that is.
Yeah. This is just liposuction, right? No fat transfer.
Just liposuction. Yep. Okay, so question is, can you do 360 and inner thigh the same day? You know, typically no. We work on one particular body area, whether it be the abdominal section and the waistline, or just the legs, or just the arms. But if you're a small enough canvas, maybe we can.
You know, it's really not, because you know, when you do the 360, we're taking out a lot of fat and we're using a lot of medication to get you numb. And smaller individuals, you can't take out as much fat and you can't use as much medication. So it's unlikely. And usually if you have the inner thigh problem, the problem is bigger than just that smaller little section. Typically we need to go all the way down to the knee to ensure the best results. So these are all things that we can discuss in the formal consultation. So if you're serious, you really want to move forward, set that formal consultation up and we can discuss these things for you specifically.
Yeah, so I should have been a little clear. It's rare that we can, but you know, it just depends on what your body looks like, but it probably not. She said something about, oh, I'm sorry.
Sorry, I was just looking at this one here.
What about the inner thighs? Is it hard to remove the fat from the upper inner thighs? No, it's actually not. That fat is not as resilient as the fat on the upper ribs.
So someone asked something here on YouTube. Says, do you suggest the Heal Fast medication for recovery? I see it was developed by a medical doctor. I have never heard of Heal Fast medication, but it sounds like a water pill. But okay,
I don't know what that is.
maybe it's vitamins or I don't know.
Look at this picture right here. This is like halfway through the procedure of full thighs. Look at how remarkable that is. Okay, so some people are going to say, well, look at that excess skin right there. No, listen, this is the actual day, okay, the day of the procedure. So this has yet to be treated. It looks amazing. Trevor did an amazing job on this particular patient. Tati is her name. And over the course of, a couple of months, the skin is going to tighten down and it's going to look phenomenal. And she's not going to have this little crease right here. But right now, because took out so much fat, there's that little bit of a crease, but it's kind of like the body is resilient and it will get rid of that naturally.
So part of what causes this at this point in the procedure is we're actually breaking up all the connective tissue that holds everything together. And so at this point, the connective tissue is not connected, in which you're going to get some weird folds and things of that nature. However, in the healing process, once you put on some compression garments, we'll put compression in that specific position, and the body forms scar tissue that kind of works like glue and sticks everything together. So all that stuff will tighten up with the natural formation of scar tissue.
So Jen, again, she got a lot of questions. I like it. She's asking about stretch marks.
Mm-hmm.
Do they go away after liposuction? So no, they just change in their appearance. Okay, so when you have a lot of fat and your skin is stretched to its limits, those stretch marks are really, really wide. After liposuction and the skin retracts, okay, they get smaller and they change in appearance, so they're not as pronounced. Okay, but no, they don't go away completely.
There's more questions about trying to treat more than just the sections that we recommend, and you guys have to realize that our recommendations are for your safety. So we make these procedures, and through the quick quote, those are the size of the procedures that we maximize the amount of fat out of you and maximize the amount of medications for that procedure. So to do more in one procedure will push the limits far beyond what's possible for you, which could cause more complications and issues following the procedure. So this is for your safety that we're limiting these procedures for you. Tati looks amazing. Absolutely.
So Kara Green says happy birthday yesterday.
Thank you.
Yeah, Tati does look amazing. In fact, she's had 3 procedures done. She had her midsection done 360, the chin, and the full thighs, and she's going to come back and do the arms and bra rolls. And so she's going to look like a completely different person. I mean, she already does. So she looks phenomenal.
So, just to reiterate, trying to do too much at one time, the people that are adamant about doing that and you go find doctors that will do that for you, typically the results are not good because they can't get that much fat out of you on all those areas. So they do a mediocre job on all the areas, which means that you didn't get your money's worth on any of it. And you're gonna have to go spend to get it all fixed somewhere else, and you probably spend 2 or 3 times the amount to get it fixed. So,
and then it's harder too, right? There was a question earlier about scar tissue impeding the ability to take it out on round 2. Mm-hmm. Yes, indeed, that's true, right? The scar tissue is a very dense, particular soft tissue, and all bets are off, really. But if there's anybody that can get it out on a second thing, it's us. Like we really work hard. But yeah, the scar tissue does create a level of difficulty that a lot of people don't like to deal with.
Right. And there's some doctors that tell patients that the plan is to come back multiple times to the same area. And it's a terrible plan. Don't ever go anywhere that says that. You do not want to go in the same area more than one time. You want to get it all done at one time, get it all out, and never have to go back there again, ideally.
The correct way.
Yeah. When you go back to these areas the second time doing revisions, the results are not as good, they're not as dramatic, and there's more complications. So it's way better to get this stuff done the right way the first time.
So Erica Flores says she's so excited she's coming in April. Awesome, Erica. I think we've commented on that. Yeah, we're excited to have you come.
Lizette Munoz.
get your labs done quick, okay,
Yeah.
within a month, all right? We don't want to, have any delays. We want to make sure that you're an appropriate candidate. Make sure that if you are a diabetic, that you're taking your medication, and that we have the green light, right, to do your procedure.
Lizette Munoz says, where are you guys located? We are located in Las Vegas, a short flight from pretty much anywhere.
Yep, easy. They make it very convenient to fly into Vegas. Can you show a pic of where there's a big RO? What does that mean?
I don't know if she was trying to say something. Maybe she, what is row?
I don't know.
Big round butt?
Yeah. Erica Flores says she's going tomorrow for labs. That a girl. Absolutely.
Right, nice.
That way, if something, oftentimes, everybody generally is healthy. We turn down very, very few patients, and the ones that we do, we try and work with, to maybe even reschedule on a future day, or we try and intervene in a way if we can catch it early enough. Like an iron deficiency anemia, we can give you some iron supplementation. We can recheck your labs and make sure that you're an appropriate level for this. So if you get it to us in a prudent time frame, we can go ahead and address some of the issues that come up.
Okay, the says, what type of techniques do you guys use to do liposuction? So we use the tumescent technique, which is the numbing process. It's what allows us to do the procedure while you're awake. Instrumentation, we use micro-air instrumentation, but technique is, it's these hands. There's lots of different techniques that we do. There's no name for it. We made it all up because we've done thousands of these procedures.
But a lot of that, I guess you can add on to that is the technique that we use is just the system that we go about, the way that we attack it, and the way that we, the things that we look for while we're doing the technique, right? So, having done this a lot, you can identify, okay, what are the areas? What is it supposed to look like midway? How, from what position is the best way to get that particular fat or treat that area? And so a lot of it is just the system that, we do. And it's able to come out quicker and faster, and you get to go home and recuperate a lot quicker.
Michoacana says, is the chin painful? In most cases, the chin is it's a piece of cake. It takes about 20 to 25 minutes. Usually doesn't hurt much at all for most people. And in most cases, the recovery is pretty quick and easy as well.
So this is why I got in trouble on Facebook. Somebody asked, I think Danny, one of our previous patients, asked for befores and afters, and I started throwing up a couple of them that I had on my phone, and some of them didn't have underwear on, right? And there was blood everywhere, but Facebook thought it was sexual, and so I got restricted from Facebook.
So Maria says she said, LOL, big belly roll. So now I got to go back and see what the actual question was because I forgot.
Can you show some pictures? Is that what she said?
Is it? Oh yeah, can you show some pictures where the big belly roll? Okay.
So there's there's another comment that says, how long would you like us to stay in town for the procedure? So we want you to show up a day ahead of time, okay? So that you can come into the office and you can get familiar where we're located, finish the paperwork, and just familiarize yourself with your surroundings, and that turns down the anxiety level. Okay, go home, get a good night's sleep with a good meal, wake up the next morning, get some food, come back. You're already familiar to our facility. We do the procedure. You're done in a couple of hours. You're back to recuperating. We want you to stick around in town for a couple of days. That way, if something were to happen, we could intervene and we could take care of you at that time, okay?
So Lisette says, what's your system? I think, I don't know exactly what you're talking about, the system, but if you're talking about like our technique, our physical technique and how we do it,
come get a procedure and we'll show you.
I'm a creature of habit,
Mm-hmm.
so I do the same thing. I've created patterns and ways that I can get these results consistently. And so I do the same thing, the same patterns on every patient, but obviously every patient's a little bit different, but my patterns are the same. And it's allowed me to be ultra efficient at getting these amazing results and getting a ton of fat out of people.
So, and I'm going to go ahead and continue with that. He is super anal retainable when it comes to his system and the way we go about it. So I was having some great success on my own, coming at, after training, 5 years ago, going out on my own. Then I come back and it's like so efficient to go like with the way he's been like doing it, right? And I can get through my cases a lot quicker, and I'm a lot more efficient, and so we can get through a lot of patients in a day by doing this effectively and repeating the same motions and just kind of like, just mainstreaming everything. So it's awesome.
And the importance really of the speed is not that we can get more people in. It's that the speed is the beneficial to the patients. This is what when I brought Kale on board, the important thing is that the speed is so crucial, because what I came across with other practitioners, they were taking 6-7 hours to do a single procedure, and all of those patients did poorly. So that was not happening to my patients, and the only difference was I was doing it in half the time. And they were able to get up and walk out, whereas the patients that took 6-7 hours ended up dizzy, lightheaded, fainting, and they had problems for days after the procedure. So a lot of it has to do with the speed, and it's traumatic to the patients the longer you're on the table. So the quicker we can get you off the table and completed, it's in your best interest.
So again, it's that adage, we can take out as much fat as your body will allow. So I was, I was in that group, right? So I did a lot of my own cases, and, they were taking a little bit longer because, of whatever. And yeah, people just, when you're on the table for more than like 3 or 4 hours, you just don't tolerate it well. And so by being able to condense that, we work together, I'll be in the room, he'll come in the room, we'll go switch back and forth, and we're able to get you done in a faster time period, and then you're able to get back home and recuperate it, and it's safer, and we can get a lot more aggressive with the amount of fat we take out.
So Ladimi, she asked, is the consultation fee included in the price of or is it separate? So in our quote system, you can see that the price for the consultation is included in the quote. So everybody who has a procedure must get a formal consultation. So that's part of the process, and you have to, it's part of the thing. Now, some people will get a formal consultation and not get the procedure, and that's $100, and they've lost that $100. However, if you decide to get a procedure, the only way you can get the procedure is to pay the $100 to get the consultation. So we meet with you. So it's part of the whole process. So just think of it as part of the procedure costs.
So what did Paula Arida say? I've been waiting patiently due to an anemia. I've been working hard to normalize my levels. Just got word from doctor. My levels are perfect, and I just need to wait 3 months. I'm coming, Trevor. How far?
Oh, what happened?
You're pushing all over.
Did I? Oh crap!
Wait, go down.
Is it down?
Yeah. Right there. Okay.
How far out can I book my procedure? How far out?
How far out? So bottom line is like what do you mean? What levels? Which levels are you talking about? Are you talking about your blood levels? I mean, your blood levels are going to change. I mean, if you cycle, so we're going to go ahead and you're going to do some labs for us, and we're going to look at them, and we're going to decide, is your body in a status where we can do the procedure, and if we feel it's safe, we can get you in a relatively quick manner. So if you're concerned and you want to just like send over your labs once you schedule your consultation and agree, then like we can get this ball moving. ¿Una persona diabética puede tener una liposuction? Sí, es posible. Bueno, tenemos muchos clientes que tienen diabetes. La única cosa es queremos que su diabetes, su estado de diabetes esté controlado con medicina, o su nivel de azúcar en su sangre está, más o menos normal, ¿ok? Porque cuando uno tiene diabetes, puede tener problemas con cenarse después de la cirugía, ¿ok?
Okay, Barbara Blake says, after a 130-pound loss with gastric sleeve procedure, my breast and butt need a lift. I would love to do a consultation. So, that's what the formal consultation is, an opportunity for you to send pictures in, and we can discuss this stuff specifically for your concerns. So you can do that at our website, myshapelipo.com. It's just below the quick quote link. Is the pubic bone included in the 360?
So Maria, we are not going to take out your pubic bone during the procedure, but we will take out fat that is residing above the pubic symphysis, or the pubic bone. Absolutely.
Fupa is what the girls call it.
Mm-hmm.
Yeah, so that's included, when we do the abdomen, if you have that issue, it's included. If you don't have that issue, it's still included.
So wait. There's let's see, Joanna Ventura, have a procedure on March 31st, turn in my labs. Still waiting to see if I'm cleared. Yeah, so, we're working through all of the labs that come through in a timely basis. Maybe I just haven't got to yours at this point because, I don't know. I don't know. I'll take a look at it tomorrow. Let me double check your name again.
What was this?
So
Joanna Ventura.
Okay, yeah, no worries. Listen, I'll take care of it. Listen, if you don't hear from me, which won't ever happen, but then that's a good thing, right? So if I'm calling you super early, then that means we've got to discuss like what we need to do.
Paula says it's her iron levels.
Okay, yeah, no worries. So just start taking an iron supplementation pill. Work with your primary care provider, and your level should stay at a certain, normalcy.
All right.
And then as long as you don't cycle or cut off an arm and bleed out, then you're probably going to be fine.
She says it's under Joanna Ortiz. We're just about done here. Let's do a couple more questions. Is the waist roll included in the abdominal lipo on the sides of my waist? I have, I don't know what's going on. It's cutting people off. So it depends. If you get the 360 lipo, if you qualify, with your BMI, if you qualify to get the 360 lipo, then yeah, it's included in 360 lipo. However, if you're larger, if you're like category 3, or 4, we have to split it up into the front of the abdomen first and then the waist second. So if it has to be split up, then no, it's not included. It's 2 separate procedures.
Hey, I just wanted to throw a shout out to Rebecca. These are her pictures. She always posts. She's always amazing, always awesome about intervening. I didn't see that she's on here today. I think that she's had maybe what a lot of us have been going through, a teenager in the house. So, and which can be absolutely infuriating and just drive you crazy. So everybody send a shout out to Rebecca in the group and say, we appreciate your support for us, and we're here to support you too. So hope everything goes better with you with what's going on with Junior. Okay.
So let's see. I think this is the last one. Do you guys have payment plans? There's a finance company that we deal with, so you can do financing. If you want to do like a layaway type program, we'll accept payments on a monthly basis. So then when you're paid in full, we can go ahead and move forward with the procedure. So those are the options that we have. If you want to get set up on any of those, I would call our office. So if you guys are ready, you're serious, you want to get started on your life journey, your life transformation, the next step is getting that quick quote. You get your basic pricing quote there. It's quick, it's easy. You don't have to do anything, send any pictures or call the office. You don't have to do any of that stuff. It's so simple. Just get your price. Now, if you're serious and you want to move forward, at that point, then you want to do a formal consultation. So if you've done your quick quote and you're serious, you're ready to move forward, the next step is that formal consultation. So click on that link on our website, get the formal consultation, and we'll speak to you and get your process started.
Listen, thanks for coming. It's Tuesday. We were going to do a video yesterday, but it was his birthday.
Yeah.
We kind of went out and just had a nice nature day and ate some tacos. So, but yeah, listen, bottom line is this will change your outlook on life, I promise you. And we have a good time doing it. So you will enjoy your experience, I promise.
All right. Thanks, guys. We'll see you next time.